lot of electrolytes like sodium ions, potassium ions, other types of ions whose levels may vary in the blood depending on diet that a person has. So these are electrolytes that if the kidneys weren't doing their job, their levels would fluctuate pretty drastically. And the kidneys, by way of what they do, they are able to control the excretion of these substances, and they tailor that excretion to ingestion. So if we consume more salt on a given day, we will also be excreting more salt based on what the kidneys do. So we're going to focus in on sodium for just a minute and check out how the kidneys, what role the kidneys play in this. So I want you to look at this nephron for just a minute. Here's the glomerulus where filtration begins. Here's the proximal tubule. Here's the loop of Henle. Here's the distal tubule. Notice this distal tubule, it comes in contact with the arterioles over here. Here's the afferent arteriole. Here's the efferent arteriole. Blood that is coming in to the nephron right here in the afferent arteriole, there is a means of communication between that blood and the distal tubule. There's some communication that happens between there. And it happens at a site called the juxtaglomerular apparatus, right here, juxtaglomerular apparatus. This consists of some specialized cells, the macula densa. And what these cells do is they detect things about the incoming blood, and based on that there can be some negative feedback that happens in order to modify the type of reabsorption and excretion that's going on in the nephron. I'd like to revisit this system in the context of electrolytes, maintaining electrolyte balance. This is this Renin-Angiotensin-Aldosterone system. This is for maintaining the homeostasis of sodium. And we're going to start up here. With a stimulus. The stimulus is going to be low intake of sodium. So maybe somebody has had a low salt diet on a given day, and that's going to end up affecting the plasma. There will be a low concentration of sodium in the blood plasma. And remember the hypothalamus is the part of the brain that monitors the osmolality of the blood. So this will be detected by the hypothalamus, that change in osmolality. So the hypothalamus then will stimulate the posterior pituitary to decrease secretion of antidiuretic hormone. So if that happens, if there's less antidiuretic hormone, then essentially what that means is that less water is going to be reabsorbed and there's going to be more urine as a result. So this is a good thing in the sense that it's going to bring the osmolality of the blood back to normal, right? So if there was low salt, then it's like the blood plasma is getting more dilute, and we want to correct for that. So increase urine volume, that's going to bring osmolality back to normal. However, we've just decreased the blood volume in doing that. So moving on over onto this side, the juxtaglomerular apparatus is what can detect that change in the blood volume, and it's going to activate the system to correct for that. So the juxtaglomerular apparatus will cause the kidneys to secrete renin, and renin is an enzyme that leads to the production of angiotensin-2. Angiotensin-2 will cause the adrenal cortex from the adrenal glands, which are sitting right on top of the kidneys. It will cause the adrenal cortex to increase production of aldosterone. Aldosterone is the hormone that I would like for you to know about. It works, it's kind of a complementary hormone to ADH. It works a little bit differently. What aldosterone does is increase the reabsorption of sodium in the collecting duct. And what's water going to do then? Water's going to go where the sodium goes. So in the end, this brings the blood volume back to normal, and it keeps the osmolality the same. So I'd like for you to know aldosterone versus ADH. What are their mechanisms? What's the difference between them? Do they have some similarities? One of them causes reabsorption of just water. The other causes reabsorption of both sodium and water. So the osmolality can be kept the same. And finally, just to finish out this chapter, I would like to just make a note about different diuretics. So these are useful clinically for treating things like edema. If there's fluid retention, sometimes a diuretic can be given to help flush out that extra fluid. And there are different types of diuretics. Now that you know about the nephron, you can imagine there are a number of different sites that diuretics could act upon. Different classes of diuretics work in different ways. Some of them end up affecting the electrolyte balance of the plasma, because maybe they're affecting, maybe they're causing fluid to be drained from the body based on the action of influencing where electrolytes go. So depending on which type of diuretic is used, sometimes it's necessary to supplement with different sorts of electrolytes, like potassium, for example.